Jeremy Leslie here with the third video related to workflow components on the Admit Manage page. This video will discuss the problem list, chief complaint, allergies, order profile, quality measures workflow, visits, quick links, and hospital course components. The first component we will discuss is the problem list component. This is a improved and much more user-friendly presentation of the data that is included in the diagnosis and problems component from the table of contents in Cerner. Due to the inefficiencies in use of the diagnosis and problems component, most providers have neglected to maintain a up-to-date problem list inside the EMR. Our goal is to have an up-to-date problem list. First, some terminology. In this component, problems can be either a this visit problem, meaning an active diagnosis for this encounter, a chronic medical problem, which is a continued medical issue but not an active problem on this encounter, or a historical problem, which is no longer active nor impacts that patient's continued care. For example, pneumonia would be a this visit problem or what was referred to as a diagnosis, and COPD would be a chronic problem. However, this could be both a chronic problem and a this visit problem if it is being addressed on the current encounter. It's much easier to add a problem using this new component. To add a new diagnosis for this encounter, such as sepsis, make sure the Add New As dropdown is set as this visit and type in sepsis. You do not have to complete the entire word, and a dropdown will show the most common items that match that text query. Clicking sepsis will now add sepsis as a diagnosis. If we want to add a chronic problem, select chronic from the dropdown, and in this instance we'll add diabetes type 2 just as DM2, which now adds that as a chronic medical problem. In reviewing the problem list, we notice that there's an acute UTI listed as a chronic medical problem. However, that is no longer a medical problem for this patient. In order to remove it, we can click the Resolve button, which moves it to the historical section. Also, if, for instance, you discussed with the patient and determined they did not have coronary artery disease and needed to remove that diagnosis, that can be done by unselecting the chronic icon, and now that diagnosis is removed. Any diagnosis you add in this component will default as a discharge diagnosis. If you need to have an admission diagnosis, for instance, responding to a Smart Zone alert, you can select the diagnosis and hit Modify, and then change the type from discharge to admitting, which would resolve the Smart Zone alert. You may also want to edit the display text for a problem. To do that, select the problem and click Modify. You can then add any text you want in the display as. For instance, changing this text to COPD on 2 liters nasal cannula at all times, which provides more information on the problem list. There is also the option to add a comment section, which will show up as a sticky note next to the diagnosis. The next component we will discuss is the chief complaint. This will pull the chief complaint text from any previous documentation and will also allow you to update the chief complaint. There's an allergy component, which is unlikely to be used by our physicians, however, does allow for adding allergies or reviewing allergies from outside records. The next component is the order profile component, which shows all of the active orders with a checkbox allowing you to discontinue an order. One use case of this component would be to select the all active medications, and then if you were to discontinue an order, you can check and hit Cancel DC, which will then go to the shopping cart and will be discontinued. The next component is the quality measures workflow. This will be used more frequently in the future in order to document quality measures related to specific problems. For instance, a stroke patient will have documentation of their last known well. The next component is the visits component, will show previous encounters for that patient. The next component, quick links, includes a link to Casper and to dbMotion. The last component to discuss for this video is the hospital course. The hospital course is a multi-contributor text field that pulls into the discharge summary with the recommended workflow that during the hospitalization, with each change in a patient's status, the hospital course will be updated. And at the time the discharge summary is created, the hospital course would have been already completed. This completes part 3 on our admit manage workflow components. Please review the discharge workflow components and check out the admit through discharge demonstration for a full idea of how these components work together.